As we approach the holiday season, you may find family members who need some help in staying healthy and safe at home. There's an array of home health care providers. The trick is finding the right fit and services. I met with a few providers and a man who directs his own care for some pointers.
So who spoke on Saturday at church?
Kristen Owens and John Sonny Cesnat are a team working to keep him healthy in his home, the house he and his 12 brothers and sisters grew up in.
I'm accepted like I don't have anything.
But he does, and as he tells you, it's a miracle he's still alive. Sonny's a heart transplant patient who also suffers from diabetes, resulting in both legs being amputated. In short, he's a complicated case. Years ago, or with less determination on his part, he'd have been living in a nursing home, something he's adamantly opposed to.
That all my freedom would be taken away.
To keep him home, Sonny employs Kristen.
All set for a walk?
She's a personal care assistant working through Consumer-Directed Choices, a local organization supporting people like Sonny, and shares his goal of staying in familiar surroundings.
They have the opportunity to stay home and to be with their families and to wake up in their beds every morning. May I have a finger, please?
Sonny needs ongoing medical supervision as well. That's where Cindy Phillips from the Visiting Nurses of Albany joins the picture, along with the VNA's telemedicine program, which can catch problems when they're easily treated.
Please take your blood pressure.
Look into Sonny's health care from at my office, at my desk. We know his blood sugar, his blood pressure, his oxygen. And with those numbers, you know, we know if his medication needs to be tweaked.
For programs like VNA and many other home health care agencies, you need a medical referral from your doctor or a referral when you're discharged from the hospital. There's an array of providers, public and private, which can also coordinate care from different organizations like Meals on Wheels or transportation.
One of the things that agencies will always tell you is the level of training that the individual who's in your home has. New York State has lots of requirements. In New York State, we also have a criminal history background requirement.
While Sonny welcomes the help, it's not always an easy sell to a relative. Joanne says a cogent argument about being able to stay at home versus placement, along with an introduction to a health aide, can turn the tide. She knows firsthand from her parents' experience.
Once that caregiver got in place, you know, it was a little bit of a transition, but she and my father, more importantly, saw the value, and now they can't live without her.
So have that conversation, and when it comes to a caregiver, always ask about credentials and training, and if your gut sense